This program is hosted by Caring Rehabilitation. This time I will talk about the exercises to prevent low back pain. If you have low back pain, what exercises should you do to prevent its recurrence? Here's the table of contents for this talk. 1. Global and local muscles. 2. Low back pain and disruption of trunk muscle recruitment patterns. 3. Size principle. 4. Draw an exercise and bird dog exercise. Global and local muscles. The muscles of the trunk can be divided into global and local muscles based on their anatomical characteristics and functions. The global muscle is a large trunk muscle located superficially and is attached across multiple segments of the spine, generating torque for spinal column motion. It also adjusts to external loads by transferring stress directly between the rib cage and pelvis. The global muscle group mainly includes the erector spinae, longissimus, iliacostalis, rectus abdominis, and iliopsoas. On the other hand, local muscles are located deep in the spine and originate and stop in the spine, providing segmental control and stability of the spine. The local muscle group mainly includes the multifidus, inner spinous, and transverse abdominis. Repeat again. The muscles of the trunk can be divided into global and local muscles based on their anatomical characteristics and functions. The global muscle is a large trunk muscle located superficially and attached across multiple segments of the spine, generating torque for spinal column motion. It also adjusts to external loads by transferring stress directly between the rib cage and pelvis. The global muscle group mainly includes the erector spinae, longissimus, iliacostalis, rectus abdominis, and iliopsoas. In contrast, local muscles are located deep in the spine and originate and are restricted to the spine, providing segmental control and stability of the spine. The local muscle group mainly includes the multifidus, inner spinous, and transverse abdominis. For spinal stability, the global and local muscle functions must be integrated. When local muscle function is compromised, spinal instability results. In a normal state of functional integration of the trunk muscles, the global muscles work after the local muscles work properly to ensure stability between the lumbar segments. Low back pain and disruption of trunk muscle recruitment patterns. There have been many reports of abnormalities in the local muscles of patients with low back pain. In patients with low back pain, multifidus muscle atrophy and its cross-sectional area are reduced. The MRI image of the transverse section of the lumbar region is shown in the figure. Grade 0, no back pain, Grade 1, mild back pain, and Grade 2, severe back pain. The area circled in red is the multifidus muscle. Compared to Grade 0 multifidus, Grade 1 multifidus shows atrophy and the atrophied muscle is replaced by fat. In Grade 2, there was more atrophy of the multifidus muscle and a larger area of white fatty tissue. Haidas et al. Stated that atrophy of the multifidus muscle occurred rapidly and was localized to the painful side, suggesting that this was not due to disuse atrophy but to reflex inhibition. Reflex inhibition interferes with voluntary muscle activity, resulting in muscle weakness and atrophy. This can lead to further joint damage. When moving the lower extremities, the core muscles contract just before the movement to stabilize the base core when moving the lower extremities. In patients with low back pain, this response is also affected. In this experiment, the thickness of the transversus abdominis and the electromyogram were measured while moving the lower limbs in the supine position. It was found that the increase in the thickness of the transversus abdominis was less and the amplitude of the electromyogram was smaller in patients with low back pain. This means that patients with low back pain have less transversus abdominis activity than healthy people when moving their lower limbs. The function of the transversus abdominis is to increase abdominal pressure. When the transverse abdominis is working well, the abdominal clenches and abdominal pressure rise left in the figure. When the transversus abdominis loses its function, the abdomen sags and the abdominal pressure drops right in the figure. For simplicity, let's consider a ball that is only half filled with air. When the transversus abdominis is working well, it will be in a position where you are straining to pinch the ball with both hands. At this time, the ball hardens into a semi-rigid body, which increases the stability of the spinal column. Therefore, when the transversus abdominis does not work properly, spinal stability is reduced. In healthy people, the activity balance between local and global muscles is appropriate. In people with low back pain, local muscle activity is suppressed and global muscle overactivity occurs as if to compensate for suppressed local muscle activity. And the concern is that even after the pain disappears, the tendency of hypoactivity of local muscles and overactivity of global muscles remains. Therefore, the activity of the local muscles that stabilizes the lumbar spine alignment remains low, making back pain more likely to recur. How can we normalize this pattern of trunk muscle recruitment in people with low back pain? You can perform exercises that use the local muscles without using the global muscles as much as possible. It is just a matter of selectively using and activating the local, multifidus and transversus abdominis. If the suppressed local muscles, such as the transversus abdominis and multifidus, are activated, the overactivity of the global muscles will naturally be reduced. Selective activation exercises of local muscles are a useful approach for correcting the trunk muscle recruitment pattern in low back pain patients with LBP. Size principle. You also need to know about the size principle. The unit in the spinal cord, consisting of alpha motor neurons, axons, and innervated muscle fibers, is called the motor unit. A unit with a large number of muscle fibers innervated by one alpha motor neuron is called a larger motor unit, and a unit with a small number of fibers is called a small motor unit. From a physiological point of view, global and local muscles can be classified as either fast-twitch or slow-twitch muscles. Fast-twitch muscles consist of larger motor units, while slow-twitch muscles are made up of small motor units. In other words, the global muscle is the fast-twitch muscle, which is composed of larger units, and the local muscle is the slow-twitch muscle, which is composed of smaller units. Now, let me explain the principle of size. When force is applied gradually, the slow-twitch muscles, which are composed of small motor units, start their activity first, and then the fast muscles, which are composed of large motor units, join in, which is called the size principle. When the output force is weak, only slow-twitch muscles and local muscles are active, and when the output force is strong, local muscles are active plus fast-twitch muscles, while global muscles are active. Therefore, the key is not to apply a large load to activate local muscles without activating the global muscles as much as possible. Specifically, the muscle output should be in the region indicated by the blue arrow in the figure. Draw an exercise in bird dog exercise. Now I will show you some specific exercises to prevent low back pain. One is the draw-in exercise, which is an exercise that selectively activates the transversus abdominis. The other is the bird dog exercise, which is an exercise that selectively activates the multifidus muscle. The basic limb position for the draw-in exercise is on all fours. When you relax your belly area, gravity will cause your belly to drop. Pull up this drooping belly and hold for 10 seconds. The goal is to be able to do this 10 times. Do not flex your torso when you pull your belly up. This causes the global muscles to kick in. Once you get the hang of it, you can do it in a sitting or standing position. The basic limb position for the bird dog exercise is also on all fours. From this position, the contralateral upper and lower limbs are raised horizontally and held in that position. To be more specific, raise your right upper leg and left lower leg horizontally and hold them in that position for 10 seconds. Next, return to the basic limb position. Raise the opposite shoulder horizontally and hold for 10 seconds. The goal is to be able to do this 10 times. Be careful not to bend over or raise your head or upper and lower limbs above the horizontal. This causes the global muscles to work harder. This time, I explained the draw-in exercise and bird dog exercise as exercises to prevent low back pain. It is important to do this every day, not just once in a while, because it selectively activates the suppressed transversus abdominis and multifidus to correct the disrupted recruitment pattern of the trunk muscles due to low back pain. Good luck to you.